name's Adam Philthorpe, and this is another one of our quick chats that we've been doing in a series around all things to do with, well, I think we've moved on from not just about COVID-19, but actually to the future of health and social care that's been digitally enabled. So with us today is Liz Ashall-Payne, who has set up and founded an organisation called Orcha, and is going to tell us a little bit more about that today. And there's a few things I particularly want to talk about. But Liz, why don't you give us a quick intro as to your organisation and what it does?
Yeah, of course, and thank you for having me. So yes, as you said, I'm the founding chief exec at Orcha, and Orcha's mission is to distribute high quality digital health solutions to people, patients and healthcare professionals. And the way in which we're doing that is by providing 5 key steps to achieving that aspiration. The first thing that you need to do if you really want to embed digital health is accredit first, so know which products are safe and high quality. And we do that by reviewing thousands of products at any given time. We do that for 11 countries. We work with the NHS nationally and locally. And this is about ensuring that a product meets the regulatory requirements and best standards and best practice. Now, once you know which products are safe, the next thing that you have to do is tell people. Sounds really simple, but how do you then promote those high quality products? And so what we do is we create digital health libraries, which are promoted at local, regional and national level to populations and patient groups so that people can now find the high quality products. The third thing that we do is we then bring healthcare professionals on that journey. And this is the idea of inviting healthcare professionals to use that library as a formulary to pick and find the right product for their patient and then prescribe it via a tool called Orcha Pro, which basically turns that library into the formulary and enables a healthcare professional to send a product via text message to their patient's phone. And then the fourth step is then to also continue to work with healthcare professionals to not only just show them how to prescribe products, but also what products to recommend at what point in the pathway for which patient groups. And so this is around care pathway redesign and care pathway integration. And then the fifth thing that we do, the final thing that we do, is we then provide the back-end procurement, and we've created with the NHS a dynamic purchasing system which allows for national organisations, regional, local, to be able to procure products on behalf of their populations. And then obviously we can support the transaction via the distribution methods that I've just explained.
Right, okay. There's a huge amount in that to unpack. It sounds, I love the aspiration. I was going to ask you, so you've been through the five aspects very clearly. The first one you talked about was safety. What are you looking about? Because we're interested in everything from sort of the health of the patient, of course, but also the data that's used, who's got access to that data, who sees it, whether or not you can recall it, whether or not you control it. And then, of course, are you looking as well at sort of things like clinical health, safety? That sounds like a massive job.
It is. And, you know, what's great is that you understand that that's a massive job, because if you think about this from a lot of people's perspectives, they don't necessarily know what they don't know. And you're absolutely right. There is a whole load of unpacking of, so there's about 2,500 regulations that could apply to a digital health solution across those different domain areas of data security, data privacy, clinical validity, user experience. And the first thing that we do when we look at a product is we're working out which of those regulations and standards.
Yeah.
Oh, sorry, I thought I'd lost you then. Which of those regulations and standards are relevant to the product in front of us? So the first thing we do basically is a risk profile across those different domains, which basically then means we're only applying the relevant standards, regulation, best practice to the product in a very proportionate way. And then, as you say, what we're looking at is those areas around data privacy, data security, clinical validity and user experience. Now, obviously, to give you an example, if a product doesn't take any data, hold any data, push any data, then obviously the question sets around data privacy and data security are much more reduced, as opposed to a product which interoperates within clinical data sets. Equally, if a product is a very intense from a medical perspective, and it's a medical device, then the process of review is equally robust and is looking for clinical evidence, which might be clinical trials. It's looking for clinical safety cases, if it requires CQC registration. And so it depends on the product how we assess it.
Okay. And you said that you're dealing with sort of 11 countries, I think I heard.
11, yeah.
So what are the numbers involved? How many people are you reaching? What's the demand for I know there's a big demand for digital healthcare, but that's often a catch-all for all sorts of different interventions. What have you seen with regards to the acceleration of take-up, if you like, or interest in this area as a result of the pandemic? But maybe you saw that anyway.
So I think there's two parts to that question. The first is what's happened since the crisis. And the second is what are the areas of interest around digital health specifically. So to take those two in turn, the first is since COVID, so we have around about 400 libraries across those 11 different countries. And what we've seen since the pandemic is a significant increase in people coming to those libraries to find a digital health solution for either themselves or their patients, which is about 180% increase in visitors to our sites. Mm-hmm. And then what we've also seen is an even greater number of healthcare professionals using those sites as formularies to prescribe from. And that's seen an increase of 6,500%. So that's been a significant increase in people not only searching and finding digital health solutions, but also recommending and embedding digital health solutions into their patients' care. And then what's been interesting since COVID is just being able to track and see what people are interested in when they come to these libraries. So at the point of the crisis, we saw a significant number of searches around COVID-19, coronavirus, as you would expect. And then about 4 weeks later, when people had found out more information about coronavirus, we then saw a huge surge growth in areas such as asthma, diabetes, COPD, so long-term conditions. And then more recently, we've seen a huge increase in searches around fitness and mental health. And so we're able to see what people are interested in as we go along this pandemic. So that's been quite interesting. Now, the way in which we work with either a country or a region or a locality is we always ask them, what is the problem you're trying to solve? So are you trying to support people with mental health conditions? Are you trying to support the obesity challenge? Are you trying to support long-term condition communities, etc.? And that's really important, and it's really important for a number of reasons. If you have a digital health library and you don't target it, it's really difficult for people to know whether that's relevant to them or their loved ones or not. And it's very difficult for clinicians to know which of their patients this works for. And so starting in a very targeted way is really important. And then obviously scaling from there. So we have libraries which are focused on pretty much all of the different clinical categories that you could expect.
Wow. Okay. That's really interesting. I like as well I remember going to keynotes. There was classic keynotes that was done by Google. It must have been 10 years ago, saying there won't be a global pandemic. I'm paraphrasing. There won't be a global pandemic because we'll be able to see just through people's search what people are searching for in real time, where clusters of things are actually happening. What you just described is actually that happening. It's in a different way. Of course, it's in a tighter community, but you're seeing the evolution of where you can almost track in which countries are at various different stages of the pandemic. Is that right?
Yeah, so it's and what's really interesting is just looking at the difference between different areas of a country. So we work with about 50% of the NHS at a local level. So that's quite a big amount of England that we're working with. And just looking at what the differences in search terms are across those different populations is really powerful, let alone which healthcare professionals are recommending which solutions to the patient groups. So yeah, I mean, we do also provide that data back to Public Health England so that they can support populations using that data.
Okay. And how, I know that one of the things we've seen, and one of the things we've learned working with health informaticians across the NHS from related organisations is the acceleration, the pace of rapid, not just change, but digital adoption. How is the relationship growing and developing, do you think, between sort of those we put in the sort of clinicians, if you like, and digital health informatics professionals? What are you observing?
So I think there's definitely a coming together, and I think that this was something that was aspired to and was being attempted to be done, and everybody wanted to do. And I think that the coronavirus and the COVID crisis has really brought about an acceleration of the bringing those two elements together. And I think that, structurally, so my background is the NHS, worked in the NHS for about 20 years as a clinician and as a leader in change management. And the way in which the NHS is structured is very often in pigeonholes. And I think that what the crisis has done has allowed for those pigeonholes to merge much more rapidly, because we've all got to come together with a unified problem and a unified mission. So I think that there has been. I mean, from talking to colleagues, that was really hard. There was a lot of reaction, but I think now the system is really getting into its own now, finding a pace and a new way of working.
And do you think this is a change that's here for good?
So I hope so. Now, I'm a massively optimistic person. My vision for the system and for myself and my family is that when we go and have a consultation with a healthcare professional, that we're not just offered drugs, that we're also offered other interventions like digital health. And I think that is definitely starting to happen. And I like to think and this is anecdotal from having conversations with people, that more and more healthcare professionals are feeling more comfortable to recommend digital health, because the crisis means that they can't necessarily see a patient and hand them a leaflet, for example. And I think that by overcoming the initial hurdle of trying a new solution, that's happened. And now what we're seeing is the impact, which hopefully everybody's starting to measure the impact, which can grow the evidence, which can grow momentum. So I am extremely hopeful. I think going back is probably going to become more and more challenging, and mainly because patients will now want what they've had.
Yeah, I think it's. I agree. I'm hopeful with regards to the impact of sort of digital health and social care. The challenge has always been balancing that against the risk, of course, which is not just in the health service but everywhere else. And that's something that I think you're doing. That's why I was so interested in your piece about safety, because there's a lot wrapped up in that optimism that can sort of bite us with regards to unintended consequences of our actions. Is that something that you're equally hopeful? Is that something that we can overcome? That seems like a community problem rather than an individual problem. But there are some aspects in there that around data, around privacy, that are real concerns, major concerns, despite the optimism.
No, I mean, I completely agree. And that safety comes out as a mistrusting of digital health solutions across our populations, patient groups and healthcare professionals. And one of the things that we always say is that trust is not unfounded. So from our work that we've done to date, around about 15% meet the quality of digital through the review process. Products meet the quality that you'd expect, which means that if you go to an app store, Apple or Google Play, you've got an 85% chance of downloading something that isn't safe, that isn't regulated. And that's the biggest hurdle. And I think that the hurdle there is about educating everybody in the system to understand what those risks are, and to say, you're not unreasonable to not trust these solutions. What we need is a trusted place to go and find these solutions. So in the same way that we can't just all go and buy drugs online, we need a safe place to be able to go and find digital health solutions. And actually, that's one of the things that doctors in the UK have called us the BNF of digital health. Because we're a safe place where you can go to find and prescribe solutions from. Now, one of the other things on this safety element is products change all the time. And if I recommend you an app today and you start using it and then it changes tomorrow and becomes unsafe, who holds that risk? And this is something that we've built into our system. So if I recommend you an app through Orcha Pro and you receive it via a text message, and we re-review it, because we re-review products every time they change and update, we can do a recall, which just ensures that risk is managed.
Yeah. So we're talking about, essentially, I mean, we've looked at this in other areas as well, sort of digital kite marking. What is the trust mark with regards to, which is not something that you see currently on, it's a bit like the Wild West, isn't it? The App Store, it's or whichever genre, but they do a pretty good job. But of course, anyone can develop for that space. So that's part of the beauty of it, of course, but there's also comes with it a slight risk. Liz, that's been absolutely fascinating. We could talk some more, but I'm mindful we need to keep these digestible. But I think there's places where people can go to find out a bit more about your work. Is that right?
Yeah, absolutely. So you can go to orcha.co.uk and find out more information. We do actually have a freely open and freely accessible digital health library to support COVID-19, and that is covid19.orcha.co.uk, and that's a digital health library which you can use to search for and find products. And if you're a healthcare professional wanting to use that solution to recommend products to your patients, you can use that. And when you sign up, type in Beat COVID and you'll be given a free pro license. And that's freely available for at least the next month.
Okay. Liz, thank you very much for talking to us today. It's been fascinating. Thank you.
Thank you.